When the kidneys are unable to remove waste and extra fluid from the blood, chronic kidney disease can result in a number of serious health issues, such as high blood pressure, anemia, weak bones, poor nutritional status, and nerve damage. It's interesting to note that sodium bicarbonate may have potential in the fight against CKD and provide some hope for people trying to slow the disease's debilitating course. Imagine a typical household object that is widely used, but sometimes forgotten, that has the ability to greatly affect how kidney disease develops. In particular, sodium bicarbonate may be a novel strategy for delaying the advancement of chronic renal disease. Today, we'll explore sodium bicarbonate, or baking soda, an unexpected ally in the battle against chronic kidney disease. When the kidneys are unable to eliminate enough acid from the body, metabolic acidosis sets up, creating an acidic environment that can hasten the deterioration of renal function. Studies have demonstrated that supplementing with sodium bicarbonate can be beneficial for people with chronic kidney disease, especially in terms of decreasing the illness's progression. Research suggests that taking oral sodium bicarbonate can assist in bringing blood bicarbonate levels into a normal range, which can lessen the kidney's acid burden and possibly postpone the need for dialysis. Sodium bicarbonate can help CKD patients with their nutritional status and muscle strength by reducing the consequences of acidosis. These results demonstrate the promise of sodium bicarbonate as a cheap and practical treatment option for CKD, highlighting the need for more investigation and clinical advice in its use. The idea of formulating drinks with sodium bicarbonate to improve kidney function, particularly for those with chronic kidney disease, gives rise to the concept of a kidney-saving soda. With its ability to treat metabolic acidosis and decrease the progression of chronic kidney disease, these drinks are made to provide a practical and tasty alternative to absorb sodium bicarbonate. The possible advantages of these drinks come from sodium bicarbonate's ability to balance the pH levels in the body by neutralizing excess acids. This is especially important for people who have metabolic acidosis, since reversing the acid-base imbalance can lead to improved blood pressure control and muscle mass preservation. There are, however, restrictions and things to keep in mind. Depending on the patient's general health situation, including their stage of chronic kidney disease, the effectiveness and safety of sodium bicarbonate can vary. Furthermore, there is a danger of alkalosis, a condition where the body becomes overly alkaline if high doses of sodium bicarbonate are consumed. The long-term implications of this consumption are also not entirely defined. Because of this, even while kidney-saving sodas provide a novel way to maintain renal health, their use needs to be done with caution. It is essential that people, especially those who have CKD or are at risk of developing the condition, talk with medical professionals prior to consuming these drinks, or taking supplements containing sodium bicarbonate. A balanced diet is essential for patients with chronic kidney disease as it slows the illness's progression and preserves general health. But let's look at some food tips. One of the most common dietary advice for persons with chronic renal disease is to consume less protein. Even though protein is a necessary food, eating too much of it can strain the kidneys. It's crucial to eat high-quality protein in moderation according to your dietary requirements in CKD stage, as recommended by a healthcare provider. Regulating the levels of phosphorus and potassium. Patients may need to restrict foods high in potassium and phosphorus depending on the stage of their chronic kidney disease, as their kidneys may not be able to keep these minerals balanced. Cutting back on salt intake. Limiting salt in meals high in sodium is advised to control blood pressure and lower the risk of chronic kidney disease progression. Consuming excessive amounts of salt can worsen blood pressure and swelling. Keeping an eye on the amount of fluids consumed. Controlling fluid intake is essential in later stages of CKD to avoid fluid excess, which can cause edema and cardiac problems. Consuming a range of fruits and vegetables can offer vital nutrients and fiber that support general health, as long as they are consumed within the limits of potassium and phosphorus. It's important to be cautious when thinking about adding sodium bicarbonate to the diet. Overconsumption of sodium bicarbonate increases the risk of alkalosis, a condition in which the body becomes too alkaline, even though it can help manage the metabolic acidosis linked to CKD. Negative health impacts from this illness include nausea, twitching of the muscles, and bewilderment. Thus, it's imperative that CKD patients consult their doctor before introducing sodium bicarbonate or any other supplement into their diet. A number of lifestyle changes, aside from dietary changes, can promote kidney health and aid in the management of chronic kidney disease. While maintaining enough fluid intake is important, it is important to adjust consumption based on personal needs, particularly in advanced chronic kidney disease. Regularly engaging in little exercise can support the preservation of general health. It can lower blood pressure and enhance cardiovascular well-being, both of which are beneficial to renal function. Lowering the stress on the kidneys through nutrition can decrease the progression of chronic kidney disease. But in order to maintain a balanced diet, it's crucial to make sure you're getting enough nutrients and maybe even speak with a nutritionist. Reducing the consumption of processed and high-sodium meals can aid in blood pressure management, which is important for the advancement of CKD. In addition to dietary sodium bicarbonate, people with chronic kidney disease may be prescribed additional supplements or medicines to address particular needs or difficulties related to the condition. Phosphate binders. These aid in regulating blood phosphorus levels, which helps prevent cardiovascular problems and bone damage. Supplements of vitamin D. Often prescribed to treat calcium-phosphorus imbalance and bone health problems associated with chronic kidney disease. Erythropoiesis-stimulating medicines, such as ESAs, work by encouraging the bone marrow to make more red blood cells in order to alleviate anemia linked to chronic kidney disease. Blood pressure medicines. Inhibitors can help control hypertension and delay the deterioration of renal injury. Patients with chronic kidney disease must have a comprehensive management plan that includes suitable medication or supplements as advised by healthcare providers, in addition to dietary and lifestyle changes. This strategy should be tailored to the patient's stage of CKD, overall health, and unique dietary requirements. Maintaining optimal kidney health and function requires regular follow-ups with healthcare providers to assess the disease's course and make appropriate treatment adjustments. Baking soda or sodium bicarbonate has gained popularity as a potentially kidney-saving treatment for those with chronic kidney disease. Its main advantage is that it can balance out the body's excess acids, which is a straightforward but efficient way to fight metabolic acidosis, a common CKD issue. By assisting in the maintenance of a healthy pH balance in the body, research supports the use of sodium bicarbonate in reducing the progression of CKD and possibly postponing the start of dialysis. As a result, moderation is essential, and adding sodium bicarbonate to the diet should never be done without the supervision of medical professionals. Patients with chronic kidney disease are recommended to follow a balanced diet, restrict their sodium intake, maintain their blood pressure, and manage their protein intake. It could also be advised to take additional medicines or supplements to address certain CKD demands. We warmly encourage you to continue the conversation about sodium bicarbonate and kidney health by sharing, and leaving a comment below. Your advice may come in very handy for those with comparable difficulties, and between us, we can create a community that is supportive of renal health and well-being.